Welcome to Echocardiography 101 Theory Foundation. Throughout this course, we will explore the essential principles of cardiac ultrasound.
We'll start with something very simple, just an appetizer. Physics is an integral part of echo because all of the principles that are applied in echocardiography is basically stemmed from physics or mathematics.
Consider joining us in our upcoming Echocardiography 101 Practical Foundation, where you'll be able to learn with hands-on experience the principles presented in this course with a group of experts. This will be especially useful if you're training in cardiology, working in the emergency room, intensive care, or with POCUS applications in internal medicine and echocardiographic technology.
So piezoelectrical crystals are inside the probe, and basically they transform the electrical energy that we put into the probe into a mechanical one. So ultrasound waves have been used for ages by other creatures, by bats and dolphins. They used it in echolocation and to hunt and travel. We humans, we used it just for the last 80 years. Echocardiography is pretty young modality. It has been there for less than 80 years, or almost 75 years now. It was introduced first in the 1950s. Nowadays we have 3D echo, where we can see chambers very clearly. We can calculate volumes, calculating ejection fractions more accurately. We can see valves more clearly now. Let's start with Doppler. I'm sure everyone has heard about Doppler when we discuss about echo, because there are so many applications applications of Doppler on echo. We can calculate pressures, we can calculate velocities, we can see the direction of blood. The sound frequency increases as the sound source moves towards you, towards the observer, and it decreases as the sound source moves away. So the frequency that is going to your side is increasing, and the one that is going away from you, the frequency is decreasing. The way we remember it is just by the acronym BART. So blue away and red towards. See now all the applications of Doppler effects and Doppler velocities. We are using it in medicine. Anyone can see, this is an echo. This is a three-chamber echo, three-chamber view, apical view. Anyone from the audience can tell me what we are seeing here?
I think it's a severe regurgitation because mosaic is reaching up to the atrium, the level of the atrium.
So why is it important? Because sometimes it underestimates the mitral regurgitation.
Because gel is technically a form of fluid, so now I'm able to cause back and forth fluid movement.
Yes, so you need a medium that will transfer the sounds.
And knobology is basically talking about the knobs. So here I'm going to ask Madame Ghada to help me kind of explain what are the important knobs for the bedside echo that we must absolutely know.
This is how the sound beam, it will go and what it will going to visualize from the heart. So all this sound beam is coming like a bit conical shape between the ribs and to go to the heart inside. That's why this is between the two lines.
So the heart probes are small probes. They're made in a way that you can image between the ribs.
Just like what we see here in the green plane. We are cutting the heart so we can see different levels. And the last one is the apical plane, which we divide the heart also in. This is the purple one. We divide the heart in a different way from the apex, and that's why it's called the apical plane. So we can see some other structures. So from each plane, we can see some structures more clearly. So we can have a comprehensive look at the heart. The other one is the apical view. basically the patient still will be in the left lateral decubitus. The third transducer position is the subcostal view. Here we ask the patient to be in the supine position, and better to also bend their knees to relax the muscles of their abdomen, so the image will be more clear.
Pleural effusion in relation to the aortic, or in relation to the aorta?
So yeah, excellent, yes. So this is the aorta. If the fluids, if we can see an echoluscence structure here, indicating fluids. So this will be, if it is here, it will be anterior to the aorta. So this is pericardial effusion. And we can divide the pericardial effusion according to its size, whether it is small, less than 1 centimeter, moderate between 1 and 2, or large above 2 centimeters.
Master valvular heart disease. Analyze complex effusions. Quantify heart failure. Detect mitral prolapse. Unlock 3D echo.